Okay, so right now we will be looking at peritonitis. Peritonitis is inflammation of peritoneum. It is acute or chronic inflammation of peritoneal layer and a peritoneal layer covering peritoneal cavity. Now if you look at the anatomy, this is peritoneal layer which covers the peritoneal cavity. And there are two types of the peritoneum. One is visceral peritoneum which covers viscera, and another is parietal peritoneum which forms the outer boundary. So in this way we can say, and the space between both of these type of peritoneum is known as peritoneal cavity or peritoneal space. Okay, so now we will be looking at the types or causes of peritoneum. Types includes primary peritoneum, means bacterial infection occurs because of primary causes are bacterial infection, blood transfusion like septicemia, genital tract infection, cirrhosis or ascites can cause primary peritoneum. Secondary peritoneum includes trauma, any stab injury or surgical trauma or chemical irritation like rupture appendicitis can cause peritoneum, perforated peptic ulcer, bowel obstruction, pancreatitis, peritoneal dialysis, pelvic inflammatory disease, and strangulated hernia can also cause peritoneum, secondary peritoneum. So the clinical manifestations of the peritoneum, first of all, patient will have abdominal pain, and the tenderness will be present over involved area, means patient will complain of pain when the area is touched. Muscular rigidity will be there and spasm will be there when we touch the abdomen of the patient. There will be rigidity of the muscles of the patient, and nausea will be there. Increased temperature means there will be fever and pulse rate will be increased. Oliguria will be decreased, means urine output will be decreased, and there will be weakness in the patient and decreased vowel sound with paleness and cold skin. So in this way, clinical manifestations of peritoneum presence. Now diagnosis, how we can diagnose the peritonitis. There will be presence of signs and symptoms like all these signs and symptoms which will be present in the patient: rigidity, fever, and pulse rate increase, and tense abdomen, tender abdomen. Blood investigations includes hemoglobin, TLC, DLC, and ESR. Abdominal X-ray should be performed. Ultrasound, ultrasonography, and peritoneoscopy is performed for diagnosis. What complications will be there in peritonitis? There will be hypovolemic shock in the patient, septicemia, intra-abdominal abscess will be there, and organ failure and renal failure will be there in the patient. So in this way, peritonitis presents. The management of peritonitis includes broad spectrum antibiotic. As the word is itis means inflammation, so antibiotics should be given for the infection like amoxicillin, streptomycin, and ciprofloxacin. And replacement of fluid and electrolyte should be given in order to prevent shock. Analgesics should be given for pain, antiemetics for vomiting, NG suction should be done, abdominal paracentesis should be done to remove fluid, blood transfusion is performed, operation procedure for close operation, and provide bed rest and laxatives or stool softening should be given. So in this way we can save the life of patient and treat the patient of peritonitis.